survival rate. Means losing a part of the breast, and there have been many scientific studies which have shown that which can severely affect her self-esteem and has psychological implications like depression, anxiety, stress, and it could also lead to interpersonal relationships. Hence, along with cancer clearance, the focus has got to be of giving equal importance to giving a good quality of life to the woman. The survival rates are high, and a woman develops breast cancer at a young age. So not only should she survive, but she also should have a good quality of life. And hence, in the past 3 decades, there has been a remarkable advancement, especially in the surgical approach to breast cancer, where breast conservation surgery has replaced mastectomy, and oncoplastic surgeries can be done for larger tumors. But in some cases, mastectomy is inevitable. After all, we want to save lives, and to not affect the cancer clearance, mastectomy or complete removal of the breast certainly needs to be done in certain cases. In such cases, what technology, better diagnosis, newer medications. She was married since 1 year. She doesn't even have issues as yet.
And using robotics to help us navigate and get the best possible diagnosis. And even in medical oncology, robotics integrated with genomic profiling, we are able to do what is called as personalized medicine, develop the right drugs for the right patient and deliver it at the right dose. And of course, Dr. Jayanti's domain, surgeons are, by using this robotic surgery, she's actually the first lady surgeon trained in robotic breast surgery. This is one step in this direction, and to get the maximum possible outcomes, precision outcomes, and with least invasion, patients are able to spend that much amount of, less amount of time in the hospital, early wound recovery, and we are able to deliver our systemic chemotherapy with, at ease.
Has demonstrated a very good mood, and the areola are left intact, comparable to other standard surgical procedures. In mastectomy, we put a very, very small cut, what are immense. It has a small 3D camera and feed in the future when she gets pregnant. So it has been mastectomy, robotic nipple sparing mastectomy. It has many, many advantages of preservation of nipple. She was married since 1 year. She doesn't even have issues as yet. Give the better psychological outcome to the patient.
Chemotherapy, surgery, radiation. So the cost overall is, overall it's quite economical when we look at it, and because the patient spends, outcomes are better. The patient's physical and sexual well-being is maintained. Fantastic approach, and delivering this in 3 of our patients, and I'm sure many more are to come. And
so I came to Dr. Jayanti. So she asked me to do biopsy and MRI scanning. With that, I came to know it is precancerous. So the doctor asked me to do robotic surgery. So I was little worried, but the surgery went well. So it is like removal of the breast and implant and reconstruction of the breast. And my operation was done in the last Friday. So the brain is connected now. Now I'm fine. So in few days I will be again back to my work, my life. Thank you.
Every 14 seconds, a Da Vinci procedure starts globally, which means through the course of my presentation, more than 40 procedures would have started across the globe somewhere. So far, this technology is very well researched. More than 38,000 peer-reviewed publications are credited on Da Vinci technology. Again, this is just a small preview, and this is just a visualization of a vessel getting clamped. Just a small sneak peek into what the technology looks like. I spoke about the technology, but it's also about creating the right ecosystem for the surgeons and also the larger care teams to feel confident about this technology. So at the heart of this technology, you see
I'm Dr. Jayanti Tulsi. I work as a lead surgeon in the Department of Breast Oncology at the Hospital ಇವತ್ತು ನಾವಿವತ್ತು ಬಿಲ್ಡಿಂಗ್ ಮಾಡಿರೋದು ಹೊಸ ಟೆಕ್ನಿಕ್ ಫಾರ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಸರ್ಜರಿ. ಅದಕ್ಕೆ ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ನಿಪ್ಪಲ್ ಸ್ಪೆರಿಂಗ್ಮಾಸ್ಟೆಕ್ಟಮಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಇದರಲ್ಲಿ ಏನು ವಿಶೇಷ ಅಂದರೆ ಇಂಡಿಯಾದಲ್ಲಿ ನಮಗೆಲ್ಲರೂ ಗೊತ್ತಿರೋ ಹಾಗೆ ಇನ್ಸಿಡೆನ್ಸ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ. ಆಮೇಲೆ ತುಂಬ ಯಂಗ್ ಆಗಿರೋ ಮಹಿಳೆಯರಿಗೆ ಇದರಿಂದ ಇಫೆಕ್ಟ್ ಆಗ್ತಾ ಇದೆ. ಅದೇ ಟೈಮಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೂಡ ತುಂಬ ಅಡ್ವಾನ್ಸ್ಡ್ ಆಗಿರೋದ್ರಿಂದ ತುಂಬ ಪೇಷಂಟ್ಸ್ ಕ್ಯಾನ್ಸರ್ ಆದರೆ ಕೂಡ ಸರ್ವೈವ್ ಆಗ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಸರ್ವೈವ್ ಆದಮೇಲೆ ಅವ್ರಿಗೆ ಒಂದು ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೊಡೋದು ಕೂಡ ಅಷ್ಟೇ ಇಂಪಾರ್ಟೆಂಟ್. ಬರೀ ಕ್ಯಾನ್ಸರ್ ಕ್ಲಿಯರೆನ್ಸ್ ಅಲ್ಲ, ಗಿವಿಂಗ್ ಅ ಗುಡ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೂಡ ತುಂಬ ಫೋಕಸ್ ಇರಲೇಬೇಕು. ಅದನ್ನು ಮನಸ್ಸಲ್ಲಿ ಇಟ್ಕೊಂಡು ಅದನ್ನು ವಿತ್ ದ್ಯಾಟ್ ಇನ್ ದ ಥಾಟ್ ವಿ ಹ್ಯಾವ್ ಡನ್ ಅ ಪ್ರೊಸೀಜರ್ ವಿಚ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ನಿಪ್ಪಲ್ ಸ್ಪೆರಿಂಗ್ಮಾಸ್ಟೆಕ್ಟಮಿ. ಅಂದರೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರಲ್ಲಿ ಕೆಲವು ಸತಿ ಪೂರ್ತಿ ಬ್ರೆಸ್ಟ್ ತೆಗೆಯೋದು ನೆಸೆಸಿಟಿ ಆಗುತ್ತೆ. ನಾವು ಅದನ್ನು ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ಮಾಡಿ ಸಣ್ಣ ಇನ್ಸಿಷನ್ ಅಂದರೆ ಕಟ್ ಮಾಡ್ತೀವಿ. ಸ್ಕಿನ್ನಲ್ಲಿ ತುಂಬ ಸಣ್ಣದಿರುತ್ತೆ, ಕಪ್ಪು ಕೆಳಗಡೆ ಸಣ್ಣ ಕಟ್ ಮಾಡಿ ಅದರ ಥ್ರೂ ನಾವು ರೋಬೋಟಿಕ್ ಮೆಷೀನ್ ಯೂಸ್ ಮಾಡಿ ಬ್ರೆಸ್ಟ್ ತೆಗೆದಿದ್ದೀವಿ. ಅದರಲ್ಲಿ ಸ್ಕಿನ್, ನಿಪ್ಪಲ್ ಆಮೇಲೆ ಏರಿಯೋಲಾ ಯಾವ್ದು ಹೆಲ್ದಿ ಆಗಿದೆಯೋ ಪೇಷಂಟ್ಗಳು ಅದನ್ನು ಇಂಟ್ಯಾಕ್ಟಾಗಿ ಇಟ್ಟುಬಿಟ್ಟು ಒಳಗಡೆ ಬ್ರೆಸ್ಟ್ ಮಾತ್ರ ತೆಗೆದುಬಿಟ್ಟು ಅದರಲ್ಲಿ ನಾವು ಇಂಪ್ಲಾಂಟ್ ಹಾಕಿ ರಿಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಮಾಡಿದ್ದೀವಿ. ಈ ಸ್ಪೆಷಲ್ ಸರ್ಜರಿ, ಅಡ್ವಾನ್ಸ್ ಸರ್ಜರಿದು ಬೆನಿಫಿಟ್ ಏನಂದರೆ ಒಂದಂದರೆ ಸ್ಕಾರ್ ತುಂಬ ಸಣ್ಣದಿರುತ್ತೆ, ಕಟ್ ತುಂಬ ಚಿಕ್ಕದಿರೋದ್ರಿಂದ ರಿಕವರಿ ಫಾಸ್ಟ್ ಆಗ್ತಾರೆ ಪೇಷಂಟ್. ವಿದಿನ್ 24 hours ನಾವು ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ಬೋದು. ಬ್ಲಡ್ ಲಾಸ್ ಆಗಲಿ, ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್ ಆಗಲಿ ಇರೋದ್ರಿಂದ ಪೇಯ್ನ್ ಕಡಿಮೆ ಇರುತ್ತೆ. ಅವರು ಕೂಡಲೇ ಅವ್ರ ಕೆಲಸಕ್ಕೆ ಜಾಯ್ನ್ ಆಗ್ಬೋದು. ಇವತ್ತು ಒಂದು ಪೇಷಂಟ್ ಅವ್ರ ಟೆಸ್ಟಿಮೋನಿ ಕೊಟ್ಟರು, ವಿದಿನ್ ಫ್ಯೂ ಡೇಸ್ ಅವರು ಕೆಲಸಕ್ಕೆ ಜಾಯ್ನ್ ಆಗ್ಬೋದು. ಆ್ಯಂಡ್ ಓವರ್ ಆಲ್ ಕಾಸ್ಮೆಟಿಕಲಿ ಪೇಷಂಟ್ಗೆ ತುಂಬ ಸ್ಯಾಟಿಸ್ಫೈ